what did you call it? Shadow IT.
Yep.
I like that term. There's definitely that concept of shadow IT is already the horse that's bolting, which makes it a real challenge for the Australian standard bearers, around healthcare information standards and the like, because the American marketing machine and other jurisdictions around the world, they're selling technology, and it's a global market. So it's really easy for healthcare providers to find something that solves their problem today. And they're not, I'm going to use the term, they're not as sophisticated on concepts around regulation and standard in technology to actually have that at the forefront of their mind to say, no, I can't choose this product for reasons. It's more, there's a product here, it's marketing to me, it's addressing what I want, I can take it now and use it. But then that creates a problem for the overall system of healthcare down the road, where once there are many people using those kinds of products, then in a way we almost have to normalize them. I'll give you a quick example. When COVID hit earlier this year, telehealth became super dominant in terms of what people need next, and a lot of the information that was being recommended out to the practitioner community was referencing products like FaceTime and Skype, and because it's already available, it's already out there. And in the technology industry, we look at that and we're going, oh, there it is again, reinforcing that those products might be okay. But I think it's part of that challenge that regulation tends to try and do the right thing, but it's lagging constantly. And we really need that innovation cycle to happen fast. And it's great that Foxo has come into the market with at least that communication side of things, that collaboration environment, purpose-built for healthcare, to give people that alternative now than thinking, let's just take Slack or let's just take Teams because they're already there, kind of thing. What are your thoughts on that?
Well, look, the NHS, when the UK got their first wave, or saw their first wave of COVID come through, they were in such a scramble. We say when we're talking with our investors that the UK got caught with their pants down because they didn't have a suitable alternative for communication across the whole of the UK. So they rolled back some of the requirements and sanctions on WhatsApp and temporarily allowed WhatsApp to be used for communication across health in the NHS. Right. So that was, a great qualifier for us to just say, all right, well, there is a problem and it hasn't been solved yet. So if they're falling back to that, there's definitely a need. And then when you look at Slack and Microsoft Teams and change management, those products are really a qualifier for Foxo. If your business is using Teams or Slack, you're mature enough to shift communications into that fashion. You're already seeing the benefits, and Slack tout that you can save up to 26% of your email traffic if you deploy Slack across an organization. So if an organization is starting to reap these benefits of real-time communication, then that's just a step towards Foxo. There's a lot more benefits than just real-time communication with Foxo. So we definitely look at those products as qualifiers to being able to merge or move over to a product, or even if it works hand in hand in some ways.
Is the team building concept fairly similar as well? So if I'm a practitioner and let's say I want to communicate with somebody who is outside of my organization, can I invite them in and join into a dedicated communication space?
Yeah, we've actually got two methods that this can work. So Yianni, you and I could be in a team and then someone else can join that team with us. But if that someone else isn't suitable to join the team and they only need us for a one-off interaction, maybe for some support, some advice, or maybe it's an administration problem, they can contact us and submit a case to us. Then it's up to you and I to claim that case. We can communicate directly with that person and we can push that case through a workflow being opened, in progress, and then closed. So what that means for the individual is they may not know you and I personally, but they know that we work in, say, the emergency department at a hospital. So then they just need to look up that emergency department to engage that department, and the people within can then communicate back. So the concept of teams has been taken a lot further than just a room full of people. It's actually got a ticketing workflow for external sources to be able to engage that team at a certain level and communicate in real time as well.
That's a really interesting distinction. So the parties don't need to be known to each other, as in personally. They just need to be trusted because they're on the system, and they represent certain skills that are needed in order to handle this particular issue. Or this, is that the definition of a case? There's a case here around a particular client. Are there any synonyms for that? Is that kind of like an episode? Is it an event? Or does the case define a particular patient?
Well, we've kept it generic as case because you can do many things with it, and it's being used in a number of ways as well. So in the administration space, IT teams are using it for their IT ticketing in their organization. So you can simply engage the IT team, submit a ticket, and it goes through that process. And then in the clinical space, you've got a radiologist that's working through their list, as I highlighted earlier. And if they come across a problem, they can push that into an administration team. That team will solve that problem and then feed it back into the radiology information system. And then it can be used almost as bookings as well. So a GP could push a patient into a bookings team at a pathology firm, for example. So we've kept it generic because it is very flexible and can be used in a number of ways.
That's a really interesting revelation there. I hadn't connected with that part of Foxo. That particular example is kind of interesting. How many times would a health provider interact with their IT department to talk about a technical issue, but in order to address it, they have to provide healthcare information about a patient in order to help the IT team to be able to identify, the case or the record or, the issue. So this kind of example that you just provided is, it happens already, but typically the way it happens is that kind of reference is happening in an environment that's not secure for healthcare sharing of healthcare information. So it's not a clinical sharing of information, but there is a sharing of information because somebody's trying to diagnose what is technically going wrong for that particular practitioner. And in order to do that, you've got a non-clinical person who needs sometimes to look at a screen or to look at some information, a study, for example, a test result, in order to be able to troubleshoot, try and replicate a particular issue. Is that kind of what you're describing there, that kind of interaction with service ticket use cases?
Yeah, but it's not always clinical. It could just be that you've got a problem with your mouse and it's not working. So it's all in the above. But yeah, it is exactly that. If they do need to jump on and share further information, then if it's done on Foxo, then if people are using like an Atlassian product, which might have their own ticketing service, that information is going to be replicated across the globe. And the way that the information is also stored and presented back to the organization, it may not be in a suitable fashion for it to be displayed internally. So, we've taken all of these concepts and workflows into account, and the way that information is captured and transferred and then stored is, bespoke to health, but also adaptable to various scenarios outside of clinical care.